I'd love to introduce who we have with us here today at University of Pittsburgh. So if the team would like to start with some small introductions, that'd be great.
My role on campus of interest to you, perhaps, is I serve as the director of Pitt's Interprofessional Center for Health Careers, which is the unit on campus where we help our undergraduate pre-health students find the best career fit for them and then help them become the most competitive applicants he or she or they can possibly be for their program of choice moving on into a career in health or healthcare.
Hello, everybody. My name is Gregory Allen. I am an academic advisor within the Dietrich School of Arts and Science here at the University of Pittsburgh. It's our biggest undergraduate school here. I work with all students coming in, freshmen and sophomores, and sometimes upper class students as well. I'm one of the students' first contacts. So I help you, start off your college career and often get you going and talk about majors and career options. And I help a lot of students on the path for different healthcare careers. I'm one of the first ones that kind of get you started and often refer you to people like Dr. Mira and other staff in our office and some of the other resources around campus as well. So I look forward to talking to you and answering some questions. Any questions you have?
Hi, everyone. My name is Mira. I'm a junior at the University of Pittsburgh right now, and I'm in the Dietrich School of Arts and Sciences. I'm majoring in biological sciences, and I'm minoring in political science and Spanish. And I'm in a few clubs on campus. I'm one of the tour guides in our group called the Pathfinders. And I'm also on the pre-med track. And originally, I'm from Delaware.
Awesome. Thank you, team, for introducing yourselves. I'd like to start off with just a small question just to break the ice here. So something that I would like to ask is, can you let the audience know, what is when you think about University of Pittsburgh, what is one of your favorite traditions of your university?
You can see us struggling because there are so many to choose from. A tradition at the university. Maybe not a tradition, but just an aspect that I really appreciate. So we were talking about Mira shared where she was from. I am not originally from Pittsburgh, but what I love about the city is that it is just a beautiful city. There's so much that's very accessible. Sometimes you come from cities and sort of getting to things is very difficult. And it is truly a lovely city as well if you haven't been able to visit. So as somebody not from Pittsburgh, those are the things I kind of treasure about being part of the Pitt and Pittsburgh communities now.
Sounds beautiful.
Yeah, I definitely agree with that. And getting around the city is so easy. We have free access to all of the buses. And so it's, without a car, especially as a college student, it's incredibly easy to explore, go to museums. That's my most favorite part about living here in Pittsburgh. And as a tradition, I really enjoy every fall and spring. We have a concert out on one of Bigelow Boulevard, which is a street in our campus. And so the university brings in a music artist, and everyone lines up on the weekend. It's either on Saturday or Sunday afternoons, and there's food trucks, and it's just a really great time to spend during the fall or the spring seasons outside. So I really, really enjoy that.
Thank you for sharing.
Like Mira and also like Dr. Mira, I am not from Pittsburgh originally as well, but I've been here a long time and can't think of any specific traditions. There's so many things that go on. Pittsburgh is a great city, like was mentioned. I consider it a small, big city. There's a lot of things to do, a lot of advantages of some big cities, but also some smaller ones as well. So it's a great place to explore, try new things. Lots of things going on and lots of resources at the university. So it's a great place. You should enjoy it.
Awesome, thank you. And actually, like, so it's noted that all three of you guys are not from Pittsburgh, but found yourselves there. So I think a question that may help our audience a little bit is like, tell us a little bit about the journey that brought you to Pittsburgh, brought you to University of Pittsburgh, whether that's through as a faculty member or as a student. Give us a little bit of insight into your journey to where you are right now.
I'm happy to go first because I think it's really tied to our conversation tonight. Is what brought me to Pittsburgh was the opportunity to work across the health sciences. So my background is as a pharmacist, as I sort of went to pharmacy school, became a pharmacist, and then went into academia as a college professor. But really enjoyed the work, just understanding healthcare, and now, especially in the US, is very much team-based. So you can't be a good physician without really understanding the roles of the pharmacist or the nurse or a physical therapist. And Pittsburgh, because of its strength in the health sciences from an education perspective, from the research perspective, and just the richness and the cutting edge of healthcare delivery in our city, it really was the place. So that the place to be. So that is what drew me specifically to the University of Pittsburgh, was to be able to work in that environment.
So for me, I came to the University of Pittsburgh. I came for graduate school, actually. I grew up in New York. I went to school at Hampton University in Virginia, and then I came here for graduate school. I thought I might stay for 2 years, but I've been here for a long time. So made it my home. Started as a social worker, working as a drug and alcohol counselor, and then eventually found some opportunities at the University of Pittsburgh, and it's been great. It's been great ever since. So.
Yeah, I initially wasn't even considering. So my story to finding Pitt as a college was my family was actually driving back through Pittsburgh on the way back home to Delaware one summer. And like we mentioned, Pittsburgh is a beautiful city. So like exiting through one of the tunnels and seeing the view of downtown and the Golden Bridges, if you've ever visited, you would definitely know the views. I absolutely love the view of the city. So I insisted on visiting the school and visiting the college. And coming to Pitt, I just love the environment as a student. There's so much to get involved in on campus and also in the city exploring. And then specifically from like a pre-health perspective, I knew that I wanted to be pre-med in college, or if not that, something in the health fields. And Pitt has such a robust hospital healthcare system associated with the university. And it's really, really easy as a student to find opportunities to get involved in research or volunteering or shadowing. And these were all things that I had learned about the school, and I was really interested in all these opportunities for undergrads. And so I was really drawn from both the academic side and also the social side of getting involved in the city and stuff.
Oh, that sounds so beautiful, Mira. Thank you so much. Actually, I love what you just described. And actually, I think I have another question to ask. Something that also I think could be helpful for our audience. Like when you think about yourself as a high school student going through the admissions process, what is a piece of advice that you would give to yourself that you think could still be relevant to students that are with us here today?
I would say if you are able to talk to current students who go there, that would be really helpful. So if you're able to go on a tour, or if you're not able to right now, I know a lot of colleges are having virtual tours in which you can still speak to their tour guides. Or if you have friends who attend the university, ask them what they like and they don't like about the university. And specifically for academics, ask them how easy it is to find resources and what the culture of the school is, if that makes sense. If everyone is working collaboratively on assignments, or if it might be more competitive or something like that, just to gauge the vibe of the school and see what's important to you. It's easiest to find out by talking to a current student, in my opinion.
Sound advice. Anyone else at the stage who would like to provide us with some reflection?
I think Mira's advice, so you can get different sources of information, but clearly talking to students and what their lived experience is, what's the day in the life of a student at the University of Pittsburgh, and certainly those of us, you'll meet. All of us have different roles on our campus, and we certainly have different perspectives or different lenses, not necessarily perspectives, but just to get a well-rounded view of an institution and what's available to you as a student. Again, I think one of the important messages is at the University of Pittsburgh, you can see that you are surrounded by people who want to make sure that you are successful. So like Gregory said, he's there helping freshmen and sophomore primarily get on good academic footing. You've got all your student colleagues around you that are willing to share their experiences, and clearly the Pathfinders are a great example of a subset of our students that are particularly poised to do that because they have the information. And then very specialized advisors like the advisors in our Interprofessional Center for Health Careers as well. And just that the center exists as an example is a testament to the investment the university has made in our pre-health students within the past 2 years, recognizing that is the strength of our university.
Anything you'd like to share with us, Gregory? Working directly with students who are probably just like trying to figure out what they're doing.
Um, I could just kind of jump on some of the things they said, but yeah, with the students I work with and with students who come to college, whether you come here or anywhere, I always recommend the students just keep an open mind with what they want to do, and whether it's majors or just potential career opportunities, because there's so many things out there, so many things which people might not always be that familiar with, that they discover that might work well with their abilities and interests, and you never know. And students we work with change their mind all the time, whether it's majors, minors, whatever, and sometimes 2 or 3 times, and then career options. Students start, I want to do this career or that career, or might be healthcare, might be something else, and then sometimes they come back to healthcare, and there's just so many opportunities in there. I did want to say one thing Dr. Meyer talked about as far as physicians or other healthcare professionals, just getting to know other healthcare professionals outside of your area. Whenever students talk to me about an interest, and let's say you want to be a doctor, and we talk about shadow opportunities or things like that, it's very good. You want to shadow some doctors and 1 or 2 different types of doctors, and then I recommend shadowing other healthcare professionals as well, just to get a better view of healthcare as a whole, how they work with each other, know the ins and outs, and sometimes people find out, hey, this healthcare field is a little better for me than this one I originally thought. So things like that. It's you just never know what can happen over time and what your interests might be and where you want to go. So a lot of us were probably like that. When I was 18, I thought I wanted to be a doctor, and then, I changed my mind after watching my older sister become one. I'm like, I don't want to do that. I'm going to go a different way. So, and it worked out well for me.
Yes, absolutely. Flexibility is the name of the game. Anything
Absolutely.
can happen, anything can change.
Mm-hmm.
But the change will always be great. So please welcome / keep welcoming. Thank you, Jonathan, for joining us on the stage. Jonathan Hurt from the admissions team, Dr. Susan M. Meyer, Director of Pitt Interdisciplinary Center of Health Careers, Mira Garg, pre-med student and part of the Pathfinders program, and Gregory Allen, academic advisor of the arts and sciences. And we also have Justin Newman from the admissions team that will be assisting you all in the chat throughout this presentation. So team, the college block party stage is all yours.
Hello, everyone. Thank you so much for your patience and joining us for You Want to Pursue a Career in Health Science. So what's next for you? So we're excited to really bring our expertise from the University of Pittsburgh to provide you some insight into you all who are interested in pursuing higher education in the health careers. So the things that we want to touch on today are specifically what are health sciences, what opportunities in health sciences exist, what should you be looking for when you're applying to colleges and looking for health science programs, some tips to strengthen your application as you're getting ready over this period of time, some additional thoughts and highlights that we want to make sure that you're aware of. We want to highlight the University of Pittsburgh, where I think we've done a good job already from what I was able to hear. And then hopefully we'll have a question and answer session briefly so we can answer some of your questions in regards to this. So the first thing is, what are health sciences? It's when we usually engage with students, a lot of times what we find is that students really focus on, I want to be on the pre-med track, and that's kind of what health sciences means to them. But health sciences encompasses a lot of different disciplines and a lot of different areas. And students may find that they may be interested in health sciences and are not aware of it, or just may have a narrow idea as to what health sciences is for them. So a general definition of health sciences are all the sciences that focus on health, healthcare, and at its core parts, their subject matter. So this is going to include mental health, like psychology and mental wellness. It's going to include social health, like psychology, but it's also going to include your traditional physical health. Now, I wanted to also throw over to Susan to talk a little bit about what she sees when she talks to students about health sciences and what they think it actually is.
Sure. Yeah. You know, it's what I often tell audiences of students who are considering a career in health or health sciences, and that can be, like I said earlier, healthcare, discovery of new medicines, the science piece of it, or even health policy is there is just so much that you haven't had the opportunity to know yet. I often tell students there's more to healthcare than what you see on TV, or more healthcare providers than you see presented on Grey's Anatomy, which is old now, I guess, but Chicago Med or things like that. So like I said earlier, lots of different, even within medicine, lots of different things I think Jonathan will touch on. But again, what we try to do is help people find their path, if it doesn't happen to be as a physician.
Thank you, Susan. So yes, exactly as you said, we did want to touch on the many opportunities in health sciences that you may have thought of or may not have thought of as you are preparing to apply to college. So I led off with some of the ones that students normally think about, like medicine, dental, pharmacy, nursing, but even in medicine, there are just so many different disciplines and areas that you may have not even thought about or may not be to the point at. So whether it be cardiology and thinking about the heart, or dermatology, which focuses on the skin structures, functions, and disease, geriatrics, which focus on the well-being of the elderly, neurology, which focuses on the brain and nervous system, oncology, which is the branch of medicine that studies cancer, pediatrics, which works with children. So there's just so many different pieces that you have the opportunity to look into and explore. I am partial to pharmacy. I am a reformed pharmaceutical technician. I worked in the CVS for 6 years growing up, and I always think that that's a great discipline that many people don't think about sometimes as a health sciences discipline to pursue. But I also wanted to throw to Susan and to Greg to talk about some of these other disciplines that students sometimes don't think about that they could definitely take an interest in and pursue in their higher education and professional careers.
Sure. I wanted to just give one example to point that out. There was a presentation for first-year health sciences students a couple of years ago from a team, and I talked earlier about how important the whole team is. And the interesting story was there was a member of the team who was an audiologist. And a lot of people don't think of it, and we have a program in our health and rehab sciences program, but in that particular office, the audiologist was the first healthcare provider that any if a patient and their family met with, because the doctor couldn't be effective, the nurse couldn't be effective, the physical therapist couldn't be effective if that patient couldn't hear what they were saying. So you have to think about sort of the different roles and how important they all are for a given patient. So I just want to give that one example to point that out. Gregory?
And I'm hitting the wrong things here. Let's see here. So it's interesting. Dr. Meyer mentioned audiology, and one of the examples I often use when talking to students, just to get them to explore different things or think about different things, because everybody comes in knowing about medicine, right, and also dentistry and nursing. Everybody knows about those areas, but people don't often know about some of these other areas. And I often mention one of our majors we have that is one of the majors we have, which people don't often know about, is called communication science disorders. And I ask students, hey, if you major in this, what are two of the common areas you can go into fields? Now, you can take this major and go into almost any field, like most majors, but the common areas are actually audiology, which Dr. Myers mentioned, and also speech pathology. And those are two great healthcare fields, which most people just don't know about coming into college. They don't know what it takes. They don't know what it involves. But they're great fields. And if you really want to work with people, you really want to help people, those are great fields to do so. With audiology, actually both these fields, you have to go to graduate school and you become you actually get a doctorate. If you go for audiology, you have to get at least a master's for speech pathology, like many of these others. But you see some of the others on this list from emergency medicine. If you want to be a paramedic, which some people do for a career, but then some people take that and go and become a physician assistant or take that and go into medicine. So sometimes people start in one area and it leads to others as well. But again, it's worth exploring many of these different areas. Physical therapy is very common as well. Another area which people don't hear about much is occupational therapy, and they work very closely together. If you're seeing a physical therapist, there's a good chance you've probably seen or will see an occupational therapist at some time. So again, there's so many of these options. There's so many ways to get to these different fields. I assume we'll talk about majors at some point, but you can major in almost anything and go into any of these fields. There's no one set major you have to do to get into medicine or dentistry or physical therapy, public health, or whatever it is.
Thank you, Greg. And as you can see, this is one of the ways that we chose these particular options is because these are all options that we offer at the University of Pittsburgh. But this is just a small portion of the options in health sciences. So be aware that there's much, much more that you can pursue within this particular field. So what to look for in a health sciences program? So there are a number of things that you want to consider when you're looking at schools and you're looking at programs for health sciences. So one of the first things that you want to look for is strong STEM programs. And while you can pursue, as Greg said, any number of majors within these areas, many of them, when you're going to be sitting for your exams and when you're going to be preparing to apply to these schools, you're going to need a strong foundation in the life sciences, and you're going to need to be able to be successful when you're sitting for your exams. Another thing that you want to look for in your school is strong pre-health advising. Because there are track of courses for many of these programs that you're going to need to take to qualify for that graduate program that you're going to be pursuing later. And I want to again throw it over to Susan, since she does head our Interdisciplinary Center for Health Careers, and talk a little bit about the importance of health advising.
Yeah, so it is really important. And at the University of Pittsburgh, the pre-health advisors work very closely with the academic advisors, like Gregory and others, to make sure you're on the right path. And so when you can and have the luxury of taking very different majors on the path towards medicine or something else, the advising is so very important to just keep you on track to make sure you meet all those prerequisites that are necessary for you to qualify to apply to a graduate program if that's what that career path demands. So advisors can help you make sure that you're taking the right courses at the right time, that you're doing it in a way that sets you up to be successful because academically, because grades do count. There are a lot of other things that make you a competitive applicant, but grades do count. But can also guide you towards volunteer opportunities, making sure that you're getting leadership exposure, that you are shadowing so that you know that you're making an informed choice. And then when it comes to application time, making sure that your application is as crisp and as complete as it can be. So with personal statements, preparing for the entrance exams, and all your application materials. These are people that work one-on-one with you and are accessible to students on our campus.
Thank you, Susan. Other things that you need to take consideration are research opportunities. Having a good research background is very important as far as your process when you are looking at graduate health sciences programs. You might be looking at institutions that are tier 1 research institutions. These are ones that have a strong commitment to research opportunities. You want to consider institutions that have strong undergraduate research funding. We have a program or a office called the Office of Undergraduate Research, which really focuses on allowing our students to take on research as early as their freshman year. Also, if they have relationships with hospitals and research clinics so that students have easy access to those. And also you can take a look at what faculty are doing for research. Usually on the websites, you'll be able to see what opportunities and what specialties that faculty members at that institution are taking advantage of. So that way, if you know what direction you want to go, you can actually reach out to those faculty members and possibly start research projects with them. While we're here, I want to throw it over to Mira, who most recently went through this process of finding a health science program that works for her. What sort of things were you looking for? What things did you find in the strong health science programs that you looked at, Mira?
Yeah, so just like I was mentioning this a couple minutes ago, but Pitt has, so I was looking at schools that had really easy like access for undergraduates to find research. I think that's really important. And even if like not having done any research in high school, you should ask what the college that you're considering, how easy is it for undergrads to get involved if they've never done anything before? And I think Pitt is an excellent school because there are so many research labs, so many professors are doing research on campus. There's plenty of opportunities for even first year. So you don't even need any experience coming in. And it's really nice because we even have a first experiences in research program, which matches up students according to mentors with like interests in the similar fields and stuff. So that was really helpful. And that was something that I looked at. And the point about partnerships with hospitals and healthcare facilities is also really important in my opinion, because that's how you can get experience volunteering in your community in a healthcare setting or like shadowing whatever field you're interested in, whether that might be like medicine or physician assistant or occupational therapy. And because the University of Pittsburgh Medical Center is so extensive, there's always opportunities to shadow different professionals, which is helpful.
Thank you, Mira. So a couple of other points that you see listed here, demonstrated success in graduate school placement. You want to make sure that the schools that you're looking at have a strong record of putting their undergraduates into the graduate programs that you are interested in. So having a above average placement rate for medical school or for a number of those other health science programs that you might be interested in. And you can reach out to those institutions to find out what those placements rates are. Some of them will post them online as well. So make sure that you're checking those out because you definitely want to go to an institution that has a strong history of placing students in the area that you want to go. And then the last thing here is looking at accelerated or combined programs. And these are programs that as an incoming freshman, you can qualify for that will basically either be a combination program, so it may reduce the number of years as a hybrid for your undergraduate and graduate program, or may guarantee admission to the graduate program as an incoming freshman. And the benefit of these is a couple. One, if you are really sure that you're interested in a specific area, it's great to just have in your back pocket, you know, you already have an acceptance to a particular school or program. The other piece is that if it's an accelerated program, these health sciences programs are extended programs. So you're going to be looking at 6, 7, 8 years of higher education. And with that comes a cost. So by doing an accelerated program, you may shave 1 or 2 years off the cost of that overall program. So I definitely encourage you to look at those as you move forward and consider a strong health science programs. So next, what things should you do to strengthen your application when you're applying to undergraduate programs? So one of the first things is that you want to make sure that you're pursuing a challenging math and science curriculum in high school. Admissions offices and programs are looking for students who are A, strong in those areas, but B, take a progressively challenging curriculum. So we know that the student is going to be successful when they enter into one of those programs. Also, you want to look for, these are going to be very similar to things that you'll be doing as an undergraduate, but look for opportunities to volunteer and internship with hospitals and healthcare organizations, so that when you're filling out your application and you have those extracurriculars and activities, that you have ones that are really relevant and relate to those health science programs that you might be applying to. Also, look to shadow a healthcare professional. So many healthcare organizations and hospitals have both shadowing programs, and they also have bridge or summer programs where you can get experience in regards to learning more about health sciences. I believe that Mira, who is a member of our medical school GAP, actually did some of these things in relation to applying to college as becoming an undergraduate. Can you highlight some of the things you did to strengthen your application, Mira?
Yeah. So in high school, I definitely was able to take some like challenging math and science courses, which I think was definitely helpful. I think it also like helped prepare me for the rigor of college. And so if you have the chance at your high school, that would be really good to do. Also, I was able to volunteer at a nursing home near my home. So that was helpful. I did that for like a year or so, and I was able to see, you know, how the elderly were cared for, and that was really helpful in helping me decide that I wanted to go into a healthcare field. And also like shadowing a healthcare professional, if you're able to do so, I think that would be a really amazing opportunity. And I actually got started by just like talking to my pediatrician who I used to go to for my yearly physicals, and she was able to guide me and like, you know, tell me where to apply to and stuff like that. So if you go and see a physician yearly, or, you know, if you're interested in, say, dentistry, you can ask your dentist if they have any shadowing opportunities. People who you already know in your community, you can reach out to them and see if they have any connections for you to get started that way.
Thank you, Mira. Some other points, while sometimes it's not always readily available, if you do have opportunities to take advantage of research, either through your high school or special programs, whether it be reaching out to your hospitals to see if they are your healthcare providers to see if they have programs, or to the local universities, you can definitely take advantage of those. Pitt offers a couple of bridge and summer programs that students can take advantage of. And then also one thing that many students don't think about as far as health sciences go when they're in high school is that important part of health sciences are your soft skills, having strong communication, compassion and empathy. And so you really develop those in a number of different areas. A lot of students in high school are doing customer service jobs, are doing jobs where you have to build relationships with people and develop those communication skills and those soft skills and customer service skills. So make sure that you're developing those, and then include those developments within your essays and in your supplemental documents when you're submitting your applications. So a couple of additional thoughts that I want you to be aware of. Understand how schools that you're interested in admit to their various programs. So some schools, for instance, when you apply to the university, if you're accepted, then you have the option to pursue any of the programs at the college or university. And that's great, because then you have the opportunity to see any of the health science related majors that you would be interested in. Some schools, like the University of Pittsburgh, you apply directly to a specific school. A lot of our students who are interested in health sciences apply to the Dietrich School of Arts and Sciences because it has the largest range of health science related fields. It has your traditional biological sciences, neuroscience, microbiology, ecology, and a wide variety of things that you can pursue that you would traditionally see. But as Greg said before, they're also pursuing other majors that may not necessarily be directly, you would think directly relate to health sciences within that area. Next, you don't have to know exactly what you want to do in health sciences right now. You have the opportunity to explore. And this is where I want to throw over to Greg as the academic advisor and talk about kind of that exploration and the different majors that you can explore for health sciences and how you can learn in that area.
Okay, so so like we said, when we were working with students, some students come in knowing they want to do certain majors, but many come in kind of undecided, but no, I want to go into kind of a different health or one of the healthcare fields. So we just start them off with often some general classes, some classes that might meet general education requirements, but also one of our science classes, another class that's related to health science. There's some of our schools have programs or have classes which are kind of like introductory classes, which kind of introduce them to many of the different health sciences, and they learn about those, and they have speakers who come in and so they can consider all the different kind of healthcare fields, or many of the different kind of healthcare fields. We do obviously have them work with our health advisors in Dr. Meyer's office. We have them do shadow opportunities or volunteer opportunities, and those are just really important. During times like now, most students cannot do shadow opportunities. Many healthcare professionals are not allowing it, which obviously makes sense. So we're having students do things like informational interviews instead. So contact a health professional, and instead of going in and watching them, call them and do an interview with them and ask them, a gazillion different questions about healthcare fields and how you got there, what it's like, the ins and outs. And you can learn a lot from that. It's not the same as shadowing, but it's still very informative and informational, and you can get a lot out of that. So those are just some of the things. I'm not sure if I completely answered your question, but.
No worries. Thank you, Greg. And then the last additional thought, be aware of the academic requirements for the health professions you're interested in. Again, I think that a lot of students will see Chicago Medical, or like I said, I'm really dating myself. I'm going back to ER. I'm going past Grey's Anatomy. But you see those different professions, and there may not be a realization as to how much time and dedication it's going to be over the next 8 or so years of higher education to pursue that field. There are fields that have different lengths and that are shorter, but you want to be aware of how much time and dedication you're going to be paying to your specific field. So for instance, I mentioned pharmacy. Some of those programs are 6 or 7 years. And then you have things like athletic training, where it is 4 years as for 4-year degree and then certification. Susan, can you talk any more to that about the varying options and kind of the commitment and timeframes for these different fields?
Sure. So if you remember back that Jonathan had shared a slide that had all kinds of different programs on there, and they were mixed in that, and at the University of Pittsburgh, there are health-related fields that you can enter with a baccalaureate degree. So after, if you successfully complete that degree program in 4 years, nutrition science is one of those. We have an undergraduate degree in health information management. A baccalaureate program in nursing, for instance, is 4 years. Then there are others that it takes another 1 or 2 or 3 years at the master's level, or a professional doctoral program. And then there are others that they're like Jonathan said, not only additional degree programs at the doctoral level, but then residency training as well. So it really runs the gamut. And sometimes you can use those baccalaureate programs in health sciences as a way into another program. And I think Gregory mentioned that, like emergency medicine is a great example of those programs where it can lead you to a career at the end of that baccalaureate program, or it can be that preparation for advanced training in a health profession. And then that's where some of the accelerated programs that Jonathan mentioned, if you're interested in a master's in public health, for instance, not direct patient care, but certainly important in healthcare, Pitt now has a 4+1 program. It used to be 3+2, but recognizing some of those cost considerations, moved to a 4+1. So you're really doing essentially 6 years of training in 5 years and paying undergraduate tuition for 4 of those. So we have lots of those creative options, trying to make all of these careers as accessible and as cost effective for the student as possible.
Thank you, Susan.
Jonathan, can I just say, just
yes,
really quick, just to kind of jump on there, just always want to emphasize and always want to remind people that whatever you major in, you can take these majors and go into these different healthcare fields, especially the professional ones, whether it's biology, or you can major in history and Spanish and go in these different fields. And also, it's important to know that if you're not sure which healthcare field you want to go into, many of them have similar prerequisites, at least in the beginning. So if you're interested in medicine or dentistry or pharmacy, or even like PT, they start kind of similar. You need many of the same prerequisites, at least in the first year or two. And then you can kind of decide from there which direction you want to go. So that's always kind of a nice thing. The prerequisites are similar, at least in the first couple of years, for many of these programs. Not all of them, but for many of them.
Thank you. So I am going to jump to our question slide where, like I said, we're just approaching 8 o'clock due to the technical difficulties. So I want to jump in and see what questions we have, so we have some time to respond to some of the things that you all have said, see if we can provide some answers there. So give me just a moment as I pull this up. So the question we have here: are colleges and medical schools separate, or are they sometimes, are they both? I get confused sometimes when doing my own research. So can one of our panelists speak to that about colleges and medical schools and their relationships to one another?
So I'll take a stab at that. I think maybe it's a confusion about maybe college versus school. In most cases, there used to be a technical difference between them. Those words are used pretty interchangeably and might be institution specific. So at the University of Pittsburgh, we are organized around schools. And so you have a big university, and then those units, you can think of a school as a very specialized unit within the university. So as you're looking, you might see College of Pharmacy one place, you may see School of Pharmacy somewhere else. They're the same thing, if I'm interpreting the question correctly.
Thank you, Susan. So we have another question. How would you describe life in the medical programs? How is the atmosphere and how are the experiences? So I'll aim that at Mira, who's currently going through that currently.
Yeah, I mean, I really enjoy classes here at Pitt. I think everyone is really collaborative about like literally every class that I've been in so far. I've always easily found study groups and friends who are taking similar classes so that we can all study together. And that's what has really helped me because science classes are difficult. Um, and especially at Pitt, they are rigorous, which I think is really helpful because they prepare you for graduate school, whatever graduate school you are interested in applying to. But the mentality of students is very collaborative, so I have always appreciated that.
Thank you very much, Mira. We have a question here. What are some good health science jobs and majors revolving around lab work? So I think
go
ahead.
Okay, I just wanted to answer that quickly. Yeah, so around lab work, so it's really helpful that at Pitt there are a lot of research and labs around campus. So if you choose to come here for college, you can email a lot of lab professors and ask them to work as a lab technician. And I have several friends who are like working as a lab technician, which is really great because then you're able to earn some money and also get some experience in research, and that can be on your resume when you're applying to graduate school. So yes, you can work as a lab technician and maybe other jobs as well.
And even as a career, it's not research or patient care. I think you'll find when you're at the University of Pittsburgh or other institutions where you'll hear about the physician scientist, for instance, where at Pitt we have an MD, PhD program, or a lot of your faculty members might be doing research either in the lab or clinical research and providing patient care. So it's also, it's not one major on your way to one particular career. Like we said, lots of different pathways. There's also lots of combinations of job requirements where you can do lab work and patient care as well.
Hi, team. Hi, Jonathan. Just gonna
Hello.
get us started on closing out. Thank you all so much for your time this evening. Before we let you go, do you all have any parting words for our audience this evening?
Yeah, have fun in your search. There, you have so many choices. I'll date myself and say, I remember when there used to be 3 television channels, and that was okay with that. I get a little overwhelmed with lots of choices, but at the same time, there's a place for you, both from a career perspective as well as length of training, and don't lock yourself in. I think Gregory said that. Do lots of exploring. Change your mind a couple times. It's okay. I think you're doing the right things if you are faced with a tough choice and want to change your mind.
Thank you.
Yeah, I think the biggest piece of advice that I could give is try not to get overwhelmed with college applications because it can feel like a lot, and it definitely is a lot at times. But talk to students, do look online, and there's so many resources. And ultimately, at the end of the day, you're going to end up at a place where you hopefully will really enjoy it. And there's a lot of resources at a lot of schools, including Pitt. So you can always make the most of it. And yeah, hope you enjoy this process. It's really exciting because you're getting to decide where you're going to spend your future.
I could just kind of just piggyback on that. Just have fun with it. Explore your many options. Talk to as many people as you can. I would also write down list pros and cons lists as far as whether it's the school you want to go to, potential majors or career options. When you think you want to do a certain major and a certain career, ask yourself why, and why over and over again. I ask my students that all the time, and they probably get tired of it. Why do you want to do this? And then I go into different reasons about why, because you want to have good reasons. You want to know why. You want to know that not only is this going to be an interesting career, it's going to fit my skills, it's going to fit my abilities, and talents and interests. Because not everything always matches up with those. So just have fun with it most of all, and explore your options.
And for me, first off, to a shout out to Barry in the chat. You're going to be a great dermatologist. Don't worry about it. Like I said, you're going to be extremely successful. I can tell. What I would say to people is to reach out. Don't be scared to connect. Especially in the application process. Don't be afraid to connect with us in admissions, especially in these tough times. We're definitely there for you to assist you. But when you're interested in research or a certain area, don't be afraid to reach out to faculty at institutions and find out what type of research they're doing or what type of work that they're doing. They really get excited to engage with students who are like-minded and who are inquisitive. So don't be afraid to connect with the people at the universities that you're interested in and make yourself known because that really is a great thing and a benefit for you. And we're all invested in your success, even if you don't know it yet.
Awesome. That was great closing advice.